Hi there, nice to meet you. I'm Dr. Sid Varman, and I'm going to be diagnosing you today. So, what is your name?
So this is Dr. Mohammed speaking. This is your page here. She's 6 years old, and this is her auntie. She'll be the one telling us about the patient. She's the informant here. So me sunanki? So the auntie's name is Saada too, and our patient's name here is me sunanta? Her name is Khadija.
Yeah. Okay.
Yeah.
And will I be talking to Sahatu today? Sahata?
Yes. Yes.
All right. Sahatu. Okay. So, um, how old is Khadija?
So shekaranta na Khadija. All right. She said she's 6 years old.
Mm-hmm. All right, great. So
Yeah.
Saadatu, is it okay if I ask you a few questions about Khadija today?
Alright, ina so ya dan miki tambaye ne akan abin da yake damunta. Alright, she said you can go ahead.
All right. So will you tell me a little bit about Khadija? Any or how is her friends, family? Is she in school? How is she doing?
Okay, to yaya yanayin gidansu tana da kanne ne kuma tana zuwa makaranta ne da sauransu. Alright, she said Khadija here, who is 6 year old, she is the eldest daughter of her mother's three children, and she is going to school. She is in nursery too.
So, okay, great.
Yeah.
Um, so Khadija, uh, where does she spend most of her time? And is that place generally more sanitary and clean or more filled with the germs?
Alright. So, wai irin gidan da kuke din akwai wani guri ne mai irin su kamar su ciyayi ko wani ruwa da yake kwance hakan nan ko ta wajen gidan. Alright. Alright. So they live in the downtown, and she in the vicinity they have bushes around their vicinity, and also stagnant water.
Sorry, could you repeat that first part after downtown?
In the vicinity, that's in her surrounding, the area where she lives,
Mhm.
they have bushes around the area and
Oh,
also stagnant water there.
got it. Okay.
Yeah.
Um, any diseases that run in the family?
Okay. Akwai rashin lafiya ne wanda kamar suna da shi ko ita ko kannanta wanda a gidansu suna fama da. Alright. She said there is no any disease that runs in their family.
Okay. Um, and lastly, how would you describe your normal day-to-day diet? What foods do you eat normally? And are the foods generally clean and sanitary when consuming?
Okay. So zaki iya ki dan mishi bayani akan irin abincin da take ci, kuma shin abincin akwai tsafta ne ko kuma dai yaya yanayin abincin, kuma kaman ki dan mishi bayani da kawai yana so ya san yanayin cin abincin da take ci da irin tsaftan shi. Okay. Uh, all right. So she said the food she eat is in good hygiene, and is predominantly carbohydrates.
Okay, thank you.
Yeah.
So, Sadatu, what is the main reason you brought in Khadija today? The main cause?
So me yasa kuka kawo ta asibiti, me yake damunta? Da me? Mhm. Okay. Okay. Akwai matsalar numfashi. All right. So she said she has fever and general body weakness, and she has easy fatigue. She works small and she start getting fatigue, and she also has loss of appetite.
Okay, got it. Okay.
And also she also has shortness of breath.
Shortness of breath. Okay.
Yeah.
Okay.
So just kiranos.
For any of those
Kiranos, no?
symptoms, oh,
Su kiranos. So please can you come again with the question again?
yeah, sorry. For any of those symptoms, is she taking any medication to deal with them so far?
Okay, to akwai wani maganin da kuke bata ne kafin ku zo na asibiti? Okay. Okay, yana sauki. Okay. So she's taking the before they come to the hospital, they used to give her antipyretics, so which used to relieve the fever for some time before the fever will come back again.
Great. And how long has the fever been there?
Yau kwana nawa zazzabi? Kwana biyar. Okay, she said she's been having this fever for about 5 days now.
5 days. Okay. Okay. And is the fever continuous and getting worse and worse every day, or is it more intermittent and coming in and out and yeah.
Okay, so zazzabin nan yana zuwa ya tafi ne ko kuma ko ne? All right. All right. So she said this fever is intermittent. It comes and go. Kamar da yaushe ya fi damunta zazzabi.
Okay, got it.
All right.
Is she experiencing any abdominal pain, constipation, diarrhea?
Akwai ciwon ciki ne ko gudawa ko amai? Okay. So wanne ne duka? Duka akwai amai, akwai ciwon ciki, akwai gudawa. All right. She also has abdominal pain, and also she has loose stool.
Sorry, what was that?
She has abdominal pain, diarrhea, and vomiting also.
Diarrhea, vomiting. Okay. Okay, got it. And any trouble breathing at all, whether that be through your mouth or your nose?
Okay, akwai toshewan hanci ne? Akwai. Okay, she's having some shortness of breath, and akwai tari kika ce? All right, so she's having shortness of breath.
All right, got it. And I wanted to ask, any leg swelling of the leg?
Akwai kumburi ne a wani waje a jikinta? Ko kafa? Okay, she doesn't have swelling in any part of the body.
Okay, got it. All right, so I want to check a few things. So for the fever, can I take your temperature?
Yes, her temperature taken is 39.5 degrees Celsius.
Okay, definitely seems like you have a fever. And can we check the palms of your hands and the bottom of your eyes for any paleness?
Yes, I can check it for you. You can see the conjunctiva here is pale actually, and the palms also is pale compared to mine. Is pale, so she's pale.
Got it. Okay. So right now I'm suspecting a complicated case of. Are you there?
I'm here. I'm here. Go
Got it.
ahead, please.
Okay. So right now I'm suspecting a complicated case of malaria with nutritional anemia. So to test for that,
Okay.
I want to run a rapid diagnostic test for the malaria
Okay.
as well as a blood film. And for the nutritional anemia, can we do a full blood count to check hemoglobin levels?
Yes. For the rapid diagnostic test and blood smear, all revealed 2 pluses of malaria, and the hemoglobin level of this patient is 6.8 gram per DL.
Okay, got it. Okay,
Yeah.
and may we run a blood culture for typhoid fever just to be sure?
Yes, blood culture for this patient actually yielded positive culture for Salmonella typhi.
Typhoid. Okay, got it.
Yeah.
Okay, and just want to reiterate any, so you're sure there's no trouble breathing at all through your nose and mouth, no productive cough, sore throat.
Yes, no productive cough, but there is shortness of breath, but that one comes during activity.
Okay, got it.
Yeah.
Makes sense. Okay, so I'm going to diagnose you with a complicated case of malaria, as well as typhoid fever and nutritional anemia. So for treatment, for malaria, I'd recommend, since it's a complicated case, I would recommend an IV artesunate.
Okay.
Um, for the typhoid fever, I would just IV some antibiotics. Those can
Okay.
be ampicillin or amoxicillin.
Okay.
And as for the anemia, I would definitely, since it's a severe case of anemia, I would recommend parental blood therapy or blood transfusion.
Okay. Okay. That's
And
good.
that's to get your iron levels up in the blood so hemoglobin also goes up. And
Okay. That's good.
that's what I'd recommend for treatment. And as for prevention techniques, I just want to talk with you about some techniques you can use to prevent or to stay away from these diseases in the future. As for malaria, malaria just spreads through the bites of female mosquitoes. So the best way to prevent this is just avoiding mosquito bites. You can use mosquito repellent, um, mosquito nets at night, or wear long sleeve clothing.
Okay.
Um,
That's good.
as for the typhoid fever, you want to just generally keep good hygiene and sanitation. You can wash and cook foods properly before you consume them. Make sure the water you're drinking is very clean, and yeah, just keep good hand. Oh yeah, keep good sanitation and make sure to wash your hands. That's the best
Okay.
way.
That's good.
And
That's good.
honestly, for prevention of nutritional anemia, you just want to fortify the diet you eat with more iron-rich foods to get your iron levels up in your blood. Some of these foods include spinach, liver, beef, egg yolk. If you put these foods into your diet, I'm sure you'll get better in no time. So yeah.
Wow. That was excellent, Sid.
Thank
Um,
you.
you're able to know this patient has three conditions in one. She has malaria from the symptoms. She also has anemia, and she also has typhoid. And so you're able to get all those diagnoses correct. The investigations, they were also very perfect. RDT blood smear for malaria shows positive blood culture for Salmonella typhi, which was positive for this patient, and hemoglobin also for this patient revealed severe anemia. Also, you were very good in the treatment. You suggested IV artesunate treatment because this is a complicated malaria, which is very correct. Also, treatment for Salmonella typhi. You also ordered IV antibiotics, which is very correct. And also the anemia, severe anemia. As you can see, this patient is currently on blood transfusion. You can see it hanging over there. So we are doing blood therapy. This is very good of you to mention that. And also the prevention method for both the anemia, typhoid, and malaria, they were all very great. So you have done very great, Sid Varman. Congratulations to you.
Thank you. Yeah.
Yeah.
Thanks so much for doing this today.
You're welcome. So ya ce wai yana godiya, yana muku godiya da amincewa da kuka yi. So the auntie, she's also happy. Patient is also happy. They are all grateful for what you guys have done to them.
All right, great.
Yeah.